Hi, everyone, and thank you for joining us today. Today is the second webinar in our survivorship series. Today's discussion focuses on lifestyle medicine intervention. Right now, I'm going to turn it over to our moderator for today, Dr. Jeff Peppercorn. He's a breast oncologist and director of survivorship and supportive care at Mass General Cancer Center. Jeff, I leave it to you now.
Hi, thanks very much, Devin, and thanks to everyone for joining us. And for those of you who are watching later, welcoming everyone on behalf of the MGH Cancer Center and our supportive care and survivorship program. As Devin was saying, this is part 2 of a 3-part series where we've addressed the science of cancer care. That was in the last session, and we'll certainly touch on science today as well. Lifestyle and nutrition today, and on coping with cancer and managing stress, which is on March 10th. And these sessions are recorded. The first one is already available on the Cancer Center webpage, and this replaces our usual in-person patient and family survivorship conference. And it's really representative in that way of how we shifted many of our services to virtual care in response to the pandemic. And I think it's a really nice format. We can actually easier for many people to access than always coming to the Cancer Center in person. So I'm sure we're going to continue this even as we get back to doing more things in person. We offer many services, including those you'll hear about today, that are intended to support our patients and their families, both during and after completion of cancer therapy. We have too many programs to list now, but they can all be found through the Cancer Center webpage. We hope that if you're interested, or if you have needs beyond just treating the cancer itself, that you feel are not being met, or that you could get more help from, I'd encourage you to look at the webpage, talk to your care team about your needs, and there's many services you can sign up for. So with that said, I'm going to turn to our speakers. You're going to hear from 2 of my colleagues today, Dr. Betsy O'Donnell and Carol Sullivan, who are both very involved in our lifestyle medicine program. Dr. O'Donnell will speak first, and then we'll hold questions to the end. We'll be going through some of the questions that were sent in advance. We'll be monitoring the chat if additional questions come up. So with that said, Betsy O'Donnell will be speaking about lifestyle medicine and cancer care, cultivating healthy habits. Dr. O'Donnell is the director of the lifestyle medicine program and a medical oncologist in the multiple myeloma clinic at MGH. She's built our lifestyle medicine program from what was really a vision 5 to 6 years ago to a program that now services patients at multiple cancer sites within MGH, includes virtual visits as well as in-person visits, involves clinicians from multiple disciplines who are engaged in patient care, research, and education. And it's a really impressive program that if you're interested beyond attending today, I hope people can let their care team know and take advantage of. Dr. O'Donnell's interest in exercise intervention and lifestyle medicine was born out of her own passion for athletics and personal health. As an undergraduate at Yale University, Dr. O'Donnell was a Division I All-American in lacrosse, and she continues to compete in cycling. At MGH, she works to empower cancer patients to reach their optimal level of wellness before, during, and after cancer treatment. And her focus is on lifestyle interventions, including regular physical activity and healthy diet to improve cancer outcomes. So with that said, thanks, Dr. O'Donnell, for presenting to us today.
Thanks so much, Jeff. I appreciate the warm welcome. I just want to make sure we have the right screen up here. Are you guys able to see my slides? Good. All right. All right. So to some, lifestyle medicine may be a new concept or topic. So I'm going to begin and use today as an opportunity to familiarize you all with this idea of lifestyle medicine and how that can possibly complement your cancer care. So what is lifestyle medicine? This is actually a school of medicine that's been around for decades that has continued to evolve. It really focuses on the adoption of evidence-based lifestyle behaviors like diet, exercise, stress reduction, and sleep to improve and to maintain health, and also as preventive medicine. Why do we care about lifestyle medicine, and particularly in the cancer population? Why is it significant? Make sure this is moving forward. I seem to be having a glitch in my computer. There we go. And so why do we care about this? So, we have data that show that lifestyle medicine can help patients improve quality of life, can decrease the side effects of cancer therapy, can improve physical functioning, can improve mood, specifically depression and anxiety, can mitigate the fatigue and cancer-related fatigue. And in addition, there are data that suggest that attention to lifestyle medicine considerations can actually improve cancer outcomes. There are 6 pillars of lifestyle medicine, and those include exercise, sleep, social connections, stress management, substance use, and nutrition. I'm going to do a little bit of a whirlwind tour with underscoring some of the important features and tips with regard to lifestyle medicine, with the exception of nutrition, which my colleague Carol Sullivan is going to masterfully cover in good detail. So as Dr. Peppercorn noted, exercise is a passion of mine. And, you know, not only is it something that I do because I think it's healthy, but I think there are benefits. And for cancer patients, it may not be a passion, and that's okay. It's different for every person. But I do want to share with you some of the benefits that we can see with exercise. Again, it improves quality of life. There are strong level evidence that support this. It can decrease cancer-related fatigue. That's actually interesting because it's almost counterintuitive that doing something that can make you tired will actually reduce your cancer-related fatigue, but it is one of the few things, evidence-based exercises, that can improve cancer-related fatigue. Exercise can decrease anxiety, improve emotional well-being, improve libido or sexuality, can decrease sleep disturbances, and improve social function. One of the most common questions that we get in lifestyle medicine clinic is exercise safe? And that's a question that we'll discuss that does have to be answered by your oncologist. But overall, in general, exercise is safe before, during, and after cancer treatment. And again, it can improve fatigue, anxiety, quality of life, can also lower body mass index, improve muscle strength and fitness, and there are very low incidence of adverse events or people getting harmed from exercise. So it is safe and it is beneficial. In addition, I mentioned that there are some data that suggests that exercise improves cancer outcomes. So here are some studies that highlight this detail. Women who participate in moderate exercise, so 3 to 5 hours a week, had a 50% lower risk of breast cancer recurrence, breast cancer death, or death from any cause. Colon cancer patients who engaged in the equivalent of walking 6 or more hours per week at an average pace had a 47% improvement in disease-free survival compared with inactive patients. And both breast or colon cancer patients who increased their physical activity following diagnosis experience a decreased risk of dying. So even if you're not exercising now, there may be benefit to starting. What is recommended? So the ACSM is the American College of Sports Medicine, and historically they've recommended to all people 150 minutes of moderate or 75 minutes of vigorous exercise per week. In addition, and very importantly, they also recommend resistance training 2 times per week. So that's 8 to 10 exercises, doing about 10 to 15 reps at least 1 time through. More recently, their recommendations have been updated and have found that there's actually benefit even if you can get in 3 times per week of a half hour of moderate intensity exercise. And what is moderate intensity, just to give you a frame of reference? So light exercise is maybe, going out for a walk with a friend or the dog where you don't notice a change in your breathing pattern. Moderate exercise is when you can talk but not sing. And more vigorous is when you can only get a few words in. And the goal, again, is to really try and get some moderate, at least 3 days of 30 minutes of moderate intensity exercise in. And, some important principles are choosing things you enjoy. If you enjoy, specific activities, do those activities. If you don't like running, don't make running your goal. Choose something that you enjoy and you're more likely to adopt that habit. You don't need to start with 30 minutes. Start slowly. Have a positive experience where you get the exercise done, but don't injure yourself or really tire yourself out, and build up to that 30 minutes. You don't need to do it every day to start. Try to do it every other day, but start at a pace that seems right for where you are. Again, target that moderate intensity. Sometimes it's hard to exercise by yourself, so try classes, aerobics, yoga, Pilates. Right now, we're very limited because of COVID, but there is a large amount of content that's free on the internet and on YouTube. And in addition to that, as part of the lifestyle medicine program, we've created 8 exercise videos that are on our website. If you Google MGH exercise videos, they're also available on YouTube. They're 30 minutes each. They were created as part of our partnership with rehab medicine and physical therapy with specific moderations for cancer patients. Many of the people in the videos are cancer patients. 6 of the videos are for cardio classes, but there is 1 dance video as well as a yoga video. So that's a free resource that is available to you as you look for things to engage in exercise, particularly during COVID. Some people need support, many of us do. And so if you do, if you can engage a friend or a training partner, that's often very motivating for people, particularly as they embark in new habits. Talk to a fitness expert, set a goal. It could be a goal for a week, a specific number of steps, or it could be a 5K down the road. Use an app like a step calculator and set a goal for the number of steps you do and build that gradually. Feel the success of meeting your goals. We do have motivation counseling as well. But if exercise is not right for you right now, a very important principle is just to avoid inactivity. It's very hard now where we're limited. We're often at home. For those who are working, all of our calls are now on Zoom. So you can be in that chair for hours on end as opposed to getting up and walking and going to a meeting. So do your best to avoid inactivity. Stand when you can during those meetings. Particularly when people are first diagnosed, there's a tendency for people to want to help, to do chores and do things. Try to keep doing your normal daily activities as quickly as possible and continue those throughout your cancer treatment to the extent that you can. If you do have limitations, whether it be because of a surgery or pain related to your cancer, even if it's unrelated, we do offer at MGH cancer rehabilitation. So we have doctors within the cancer center who've trained at Spalding in rehabilitation medicine, and they can help maximize your physical functioning if you do have limitations. So be sure to talk to your doctor. If you do, they can refer you, and that resource is available. An underutilized resource for patients looking to exercise or engage in movement is physical therapy. We have physical therapists here at MGH that are trained to work with cancer patients, but they're available in the community as well, or even any regular physical therapist can help get you started. A lot of cancer patients feel vulnerable and want some supervision as they get going, which is very understandable. Physical therapy is covered by insurance. You can refer patients for cancer-related fatigue and deconditioning. So if you're looking for a little guidance and supervision, this is a great resource that can be available to you. But before you start, make sure you talk to your oncologist. If you're not already exercising, make sure. You don't want to get injured. If you are in the middle of your chemotherapy, sometimes there may be specific limitations of what you can and cannot do. So have that conversation before you get started. And also think about tailoring your exercise program to achieve your specific goals. I will often ask patients in lifestyle medicine a general safety screen, things, that we would be concerned about are chest pain or shortness of breath if you exercise. So be sure to talk to your oncologist or your primary care physician before you engage if you do have these symptoms. Otherwise, exercise can be a wonderful complementary part of your general wellness. Moving on to sleep, the next pillar of lifestyle medicine. Sleep is so important. It's such an important part of our health. We spend a third of our lives asleep and we need it. And when we go to sleep, our brains are not shut off, they're active. And there are a lot of important restorative changes that go on as we sleep. People often ask, how much sleep do I need? For most adults, that's 7 to 9 hours, but everybody is different. And you have to listen to your body and tailor your sleep to what your actual needs are if you need more, for example. But really shooting to get a minimum of 7 hours of sleep is important for your rest and restoration. Sleep disorders are more common in people with cancer, and this is for a variety of reasons, but the 3 that I've highlighted are the physical changes. So some people have pain that can cause them to have sleep disturbances, the side effects of treatment, whether it be if you're taking steroids that cause insomnia at night, and just the general stress and anxiety that can be related to cancer, not being able to turn off your mind at night. So how can you help this? What are some pearls to addressing sleep? So sleep hygiene, which is kind of the health around sleeping or setting up a routine. Trying to go to bed at the same time every night, trying to wake up at the same time, your body gets accustomed to that rhythm and it becomes more easy for your body to go to sleep and to wake up. Prepare to sleep. Start to decrease the stimulation in your household, start to wind down. Give up substances that might detract from a good night's sleep several hours before. Those can include nicotine, alcohol, caffeine in particular, and actually exercise during the day. It's better for sleep at night. So what can you eliminate? As I mentioned, caffeine, nicotine, alcohol. Make sure there's at least a 3-hour window before going to bed. And for most people, it's more for caffeine. Minimize late night stacking. That might kind of recharge you and revitalize you. And power down the screens. So that blue light that's given off by our screens activates the brain and it suppresses melatonin, which is your body's natural sleep hormone. It can also interrupt your circadian rhythms. So taking a break from the screens, at least an hour before you try to go to sleep, for those who have difficulty falling asleep, may be beneficial. Other things, take a warm shower, warm bath, do some gentle stretches. Try to read, maybe not on your screen, but an old-fashioned book, it might help. One of those eye masks, or listen to a guided meditation or a soothing playlist. Putting together a soothing playlist on your phone, as many people can become a routine that helps, again, get your body into the mood of going to sleep. Music improves sleep by calming the body. It also reduces the distraction of anxious thoughts and prepares the brain's sleep response, particularly if you do it consistently. It becomes a ritual. So those were some tips on sleep. And now I'm going to move into social connections. Everybody needs support. We're all human. We need people, as part of our life. And it affects our physical and mental health. The most important predictor of human happiness and longevity, living long, is having strong social connections. And health-related measures like blood pressure and heart rate improve with even just a short amount of positive social interaction. Cancer itself can be very isolating and, can be a struggle for social support. The treatment sessions are long, and right now we don't allow people to bring visitors with them for treatment, which is really challenging. Being immunocompromised may require you to limit your exposure to the outside world. That's particularly heightened now with COVID. And then there's also the emotional isolation, where you may be having, your life is so different than what many of your peers may be experiencing, and not having a sense of connection to people. So, recognize that social support is needed throughout the cancer journey, from the time you're diagnosed and being worked up, during your treatment, but also through that survivorship period. After kind of, that intense period, there's this healing period. And particularly if cancer is related to end-of-life considerations, there's a true need for support around that. Strong social support can minimize stress. If you confide in a friend or you have people who partner with you in the journey, that can improve your confidence in your decision making, and it can decrease feelings of loneliness and isolation. What are some ways to strengthen existing connections? Even just saying a quick hello to people, engaging when you walk in to a building, saying hello actually makes you feel better. Making eye contact, connecting with people, whether it be virtually, FaceTiming them, or on the phone. Also, giving support can make people feel better and supportive. So being there for those who need you can actually make you feel more connected. One of the things to be aware of, and particularly now, as again, we're so isolated with COVID, is the amount of time we spend on screens and looking at social media. And remember, those Facebook and Instagram posts, those are highlights reels of people's lives. And the use of social media has been associated with higher risk for depression. So recognize how it's making you feel. If it is making you feel good and connected, that's fine. But if you're feeling like you're missing out or that it's more depressing to you, recognize that limiting that may ultimately be better for you. And look for online communities. I know we've been really, since COVID has begun, able to do more of these types of virtual workshops and also virtual support groups. American Cancer Society, cancer.net often will offer disease-specific support groups. So look for those resources because they're increasingly out there and may help you find people who are going through a similar experience with whom you can connect. The next pillar I'm going to discuss is stress management. Life is stressful, and I think this picture is always so interesting, and they've done this with other presidents. This is over the course of the presidency. You can see that Barack Obama has gone from not having much gray hair to a full head of gray hair. Stress and fear affect our whole body, our central nervous system, our autonomic nervous system, meaning our heart rate, our blood pressure, the rate of breathing, our adrenaline, and our muscles, our tension, our jaw tension. So how do we lessen stress on our body? And cancer is inherently stressful. There are mind-body therapies like meditation, yoga, tai chi, prayer, acupuncture and acupressure, exercise, balanced nutrition, positive emotions, laughter and humor, gratitude, support, as we mentioned, and sleep. These are antidotes to stress. I think this is an apt cartoon for many of us. So being aware of your stress, identifying those signals, build your coping resources, figure out the tools that will help you promote positive emotions and health behaviors, find the things that make you feel better and gravitate towards those. What you think you become, what you feel you attract, what you imagine you create. As I mentioned, meditation can be wonderful for self-care. There are a cascade of events. It can lower your blood pressure and your heart rate, can improve bowel symptoms, can improve your mental health like anxiety and depression, and can help release physical tension. Yoga is another thing that can help. It has to be individualized to your overall level of fitness and flexibility. Certainly, I am not someone who benefits from yoga. I tend to hurt myself because I'm so inflexible, but I think I would have to be in a beginner class, whereas Lauren Winters, who's one of our lifestyle medicine providers, is also a yoga instructor and leads our videos, is a phenom. So find the right level for you. Talk with the teacher ahead of class. Let them know if you have concerns or limitations, whether those are due to your cancer or otherwise. Use props like blocks. We've shown that yoga can be beneficial in cancer. And I just want to let you know that our Cancer Center does offer acupuncture, massage, music therapy, art therapy, yoga, and Tai Chi free of charge to any patient at the Cancer Center. These resources are there, they're free, and can really be beneficial. And some of these are available in the infusion room. Some of it's a little bit more limited because of COVID, but this is on our website, and you can make appointments, and those may be of great benefit and are available free of charge. We also have support and wellness programs on a regular basis. There's a schedule on your website if you're looking to tie into some of these self-care resources. And the last pillar that I'm going to talk about is substance use. So alcohol, the less you drink, the lower your cancer risk. It's an unfortunate truth. Drinking raises your risk of getting at least 6 kinds of cancers, those including the mouth, the throat, the voice box, the esophagus, the colon, the liver, and the breast. All types of alcohol, whether they be wine, beer, cocktails, are linked with cancer. And the more you drink, the higher your risk. Why is this? When you drink, your body breaks it down into a chemical called acetaldehyde. This changes your DNA and prevents it from repairing damage. Our DNA is our cell's instruction manual that control our normal growth and function. So when it's damaged, cells can begin to grow out of control. Though it is best to limit what you drink, the overall guidelines are that men should drink no more than 2 drinks per day and women 1 drink per day. And remember that not all alcoholic beverages are the same. Beer, for example, a larger volume of beer is equal to 1 shot of an alcoholic spirit. Is it safe for someone to drink alcohol while undergoing chemotherapy? It's best to touch base with your doctor. There are certain chemotherapies that can affect things like platelet counts and clotting, which may not mix well with alcohol. And so best to touch base with your doctor if you do have questions or concerns about that. Marijuana is a topic that I get very frequently, in my clinic, the use of medicinal marijuana. Remember, there are two types of chemicals involved, the THC and the CBD. THC is what gives you that euphoric high. And so people often wonder if there are data for using marijuana for the control of symptoms. There are a number of small studies that have found that can be helpful in treating nausea and vomiting. A few studies have found that inhaled marijuana can prevent neuropathic pain or peripheral neuropathy. And in general, there are studies not done in the US. Remember, on the federal level, marijuana is illegal and it cannot be studied in clinical trials, but studies in Canada and Israel have demonstrated that patients who use marijuana may use less pain medications, such as narcotics like oxycodone. But remember, there are harms associated with marijuana, including the high can lower people's control, cause disorientation. It may also increase feelings of anxiety or paranoia. Inhaling harmful substances. Inhaled marijuana can have some of the same harmful substances that are in tobacco. It's hard to know what you're getting. Different strains have different potency, and ingesting or edibles may vary between different people and what other foods you've consumed with them. There are medically approved, FDA approved cannabinoid drugs that are based on marijuana compounds that you can have prescribed for the treatment of nausea and vomiting. And in general, what is the American Cancer Society? They say that it should be made as a decision between you and your doctor, and you have to balance the potential benefits with the harms that we know of using these types of substances. And finally, smoking is still the leading cause of cancer. At any point during a cancer workup, diagnosis, or treatment, we are here to support you in quitting smoking. We have several programs available at MGH to assist you. It can be very challenging. We appreciate that and want to help to support you in that process. Carol is going to step up next to talk about nutrition, and I just want to let you know, as Jeff mentioned, we do have a clinic. If this is something that's interesting to you, we do provide individualized consultation. We have a multidisciplinary approach where you would see either me or my colleague Lauren Winters as a medical oncology provider with a nutritionist as well. This is our team that's grown over the year. I'm very proud of this team. I'm extremely passionate about helping patients and improving their wellness. So know that we are out here. And also I mentioned, we do have a lot of referral therapies. Sasha Knowlton is our pain medicine rehab doctor. And when I mentioned cancer rehab, she trained both at Spalding and Sloan Kettering. Jess Garden heads up our physical therapy for oncology and is featured in our videos. And Shali Ramchandani is an obesity medicine expert who helps our patients. In addition, I mentioned integrative therapies. Thank you so much for your attention, and I leave it now to Carol to take it from here.
That's fantastic. Thank you so much, Dr. O'Donnell. Great talk and great service that you're providing to our patients. As I said, we'll come back for questions at the end, but if this sparked any questions, you can send them through the chat at any time. So we'll now turn to Carol Sullivan, whose talk is called Fighting Cancer with Your Fork, Nutrition Tips for Survivors. Carol Sullivan is a registered dietitian and a certified specialist in oncology nutrition. Her individualized and evidence-based approach to nutrition has helped many patients thrive through the challenges of treatment and the oft confusing time after treatment is complete. She sees patients in our survivorship group through the MGH Cancer Center Lifestyle Medicine Program, as you heard, and she enjoys helping people make positive nutrition and health behavior changes. She's also worked to establish our first groups recently for lifestyle medicine, which we anticipate will be a popular and growing service. So with that said, thank you, Carol, for presenting to us today.
Thank you, Jeff. Thank you, Dr. Peppercorn, and thank you, Dr. O'Donnell. Can you guys hear me and see my slides?
Perfect.
Good. So today we are going to try to get into some of the details on nutrition and cancer survivorship, but I will also encourage people, if they have questions after the session today, if you want to make an appointment with myself or one of the other oncology dietitians, I would definitely encourage you to do that just by asking your provider to make a referral. So I'll make that plug now before I forget to do it. So my name's Carol Sullivan, and as Jeff said, I am a certified specialist in oncology nutrition. And today, what I really want to talk about is some of these recommendations that come from the American Institute for Cancer Research. And these are really the recommendations for cancer prevention, but they're also the recommendations for prevention of recurrence. So we're going to kind of cherry pick some of the more nutrition specific recommendations, since Betsy's done a really nice job of covering some of these other recommendations from the lifestyle medicine point of view. So just to summarize what I plan on talking about today, we're really going to hone in on diet pattern, which includes diet quality, which is the most important part about the way that we eat, since there's no one particular food that can prevent cancer or prevent chronic disease. It's really about the pattern and the pattern of foods that we're eating, not over the course of the day, but the course of the week, the course of the month. So with that said, avoiding sugary drinks, I'll cover, and I'll try to talk a little bit about sugar and refined carbohydrates and ultra processed foods specifically, limiting alcohol, which Betsy already covered. Then I'll just touch a little bit on just the calorie content of some alcoholic beverages, limiting red meat and avoiding processed meats, limiting consumption of energy dense food with more of a focus on nutrient dense food. So thinking more about what should be on our plate. So how do we get more vegetables in, and fruits and whole grains, beans and legumes, and hopefully some practical tips on setting yourself up for success. And then I'll talk a little bit about weight control, as this can be a time-consuming part of the nutrition counseling that I myself do and my colleagues. And it really is a therapeutic relationship when it comes to trying to lose weight, and when it comes to actually trying to regain weight as a result of weight loss from cancer treatment, which can be really distressing for patients and caregivers. And then finally, just a little bit about dietary supplements, which the bottom line is to avoid the use of supplements unless recommended by your healthcare team, and that supplements shouldn't be used for prevention of cancer. So just to start, I wanted to bring this up because the 2020 to 2025 dietary guidelines for Americans recently came out, and they use this score, of a maximum points of 100 points that Americans can get to if they're actually following all of the dietary guidelines for Americans. And on average, we're not doing that great as Americans. And these recommendations are for prevention of all chronic disease. So I want to mention this because most of my talk is really about how do we include more of these foods that we know decrease the risk of chronic disease, instead of getting into too much of the nitty-gritty about specific foods, which myself and my colleagues are happy to do with you one-on-one, because we love talking about the science of individual foods, but the pattern is actually what's more important. So thinking about what your plate looks like, I love this example from the Harvard School of Public Health, and this is their healthy eating plate, and it's similar to healthy eating plates that are established by other national organizations. And really what this plate does is it takes a lot of information and it puts it into a very simple graphic. And I love that really 3/4 of the plate is plants. So if you think about vegetables, fruits, and whole grains, those are all plants. So this is really a plant forward way of thinking about your plate, where having some protein is totally fine, but we're making it more of a side dish and we're not making it most of the plate. So if we're thinking about what is actually on our plate, so we're using mostly vegetables. The greater the variety, the better. Lots of fruits, lots of deep color, and trying to vary the color that we're having week to week, since most of us are still going to the grocery store only once a week, or getting groceries delivered once a week. Trying to make sure that the grains that are on our plate are mostly whole grains. So using things like not just whole grain pasta and brown rice, but maybe even experimenting with things like quinoa is a popular one. My favorite, if you've ever worked with me, is farro, which is like a wheat berry. Has a little heartier texture compared to rice, but it's also high fiber, which eating whole grains, vegetables, and fruits gives us a lot of fiber throughout the day, which decreases the risk of especially colorectal cancer and gives us a more sustained energy throughout the day if we're really setting up our plate to have a lot of fiber on it. You'll also notice that the oils are plant oils like olive and canola. Avocado is another great popular oil that's really fantastic for cooking with because it has a high smoke point. You'll notice the beverage is water and avoiding sugary drinks. So that also means if you're having coffee or tea, avoiding sugar in your coffee or tea if possible, and slowly working yourself down to avoiding sugar in your beverages. So this is an example of what a healthy, satisfying, colorful plate should really look like. And the AICR uses the tagline of the new American plate to represent really the image that we saw before, where only a quarter of your plate might be animal protein. If you wanted to eliminate that animal protein, half your plate could be those chickpeas. We've got that deep color from that cabbage, all those great phytonutrients called anthocyanins in cabbage. We've got walnuts on here that have a great source of plant omega-3 fatty acids, which are really potent anti-inflammatories, your cruciferous vegetables, your broccoli, which is in the same family as kale and Brussels sprouts and cauliflower. So this plate would probably keep you really full and satisfied and has a lot of flavor and a lot of good nutrients happening. So to start, limiting sugar sweetened beverages. So this drink that's listed here, if you look at the nutrition facts panel, has 39 grams of added sugar. So if you are drinking out of containers during the day and you're opting for things other than water, make sure you're looking at the added sugars. This is our classic Coca-Cola that has 39 grams of added sugar, which is almost 3 tablespoons, which is a lot of sugar. This is almost fulfilling your added sugar for the day just with one beverage. So trying to replace sugar sweetened beverages with things like water with fruit slices, unsweetened seltzers, unsweetened teas, and coffees instead. One of my favorites right now, right out of Massachusetts, is called Spindrift. I love putting that in a wine glass if I'm trying not to have an alcoholic beverage to make it feel like I'm having something. And those are low calorie, but they use a little bit of tiny bit of added fruit juice in their drinks. Those are really delicious too. So just to touch on, piggyback on what Dr. O'Donnell had already mentioned about alcohol. So alcohol really can contribute to a significant source of calories as well. Most people aren't drinking only 5 ounces of wine. If you're a wine drinker, I recommend that you take your wine glass and actually grab a Pyrex and see how much wine, how big of a serving you're actually having. Same thing with the other alcoholic beverages here, especially if you are a craft beer drinker. Most craft beers now are coming in a 16-ounce can, and it's at least 8% alcohol, not 5%. So definitely look into your alcohol a little bit more closely. The next one is red and processed meat and cancer. We know that higher intakes of red and processed meat do increase the risk of colorectal cancer. And the AICR does recommend limiting to 12 to 18 ounces of red meat per week. So red meat includes beef, pork, lamb, and then examples of processed meat are ham, bacon, hot dogs, and sausage. And the recommendation for processed meats is really to avoid, which a lot of people are disappointed by. My husband's family is part Italian, and there's always processed meats at gatherings that we used to be having outside of COVID. So a lot of times I'll recommend making sure that maybe you're limiting processed meat to maybe a handful of times a year, because it's really about the dose and trying to have processed meat really infrequently. And then replacing these meats with poultry, fish, fatty fish, or some other plant-based protein sources. I love this tagline from the food writer Michael Pollan's book, In Defense of Food, and it's eat food, not too much, mostly plants. He has a lot of great books and actually a great audiobook on caffeine if you're interested in reading about food. this tagline sums it up nicely. And I just wanted to also point out that since we've been talking more about patterns of eating, we're going to talk about what more to include when it comes to diet quality. But if you want to learn more about the nitty-gritty of these nutrients that exist in our fruits and vegetables and plant foods that are called phytochemicals, the chemicals that exist in our plant foods that might have some bioactive properties that can help interrupt the cancer process, prevent cancer. This is a really great resource from the AICR's Food Prevention Facts page. And if you, on their page, hover over these foods, you'll get taken to another page that talks all about the specific properties of these foods, which is really cool. So setting you up for success to eat more vegetables and fruits. This can be a hard time of year where I find a lot of people's fruit and vegetable intake falls off just because the fresh fruits and vegetables in the store might not be as good. So really keeping frozen fruit and vegetables ready to go in the freezer that you can mix into pasta or a whole grain is a great choice. Roasting vegetables and batch cooking in the oven to add garlic, a squeeze of lemon, some onion, and keeping those in the fridge ready to go to mix into dishes is helpful. Keeping fresh carrots and cucumbers and zucchini ready to go, or a fruit bowl ready for snacking. We know that if we can set up our environment to have more of these foods, we're more likely to eat them. So if they're out, that's helpful too. Making sure you're adding a fruit or a vegetable to breakfast. Most people don't think about adding a fruit or a vegetable to breakfast. So take a moment and think about that and think if there's a way that you could add one. A trail mix with nuts and dried fruit can be a great to-go breakfast. Most people wouldn't think about that as a breakfast, but it's an easy one and super portable. And then lastly, finding some inspiration. There's great social media for beautiful foods to make, and there's also a million cookbooks that you could find that might resonate with you that would be good inspiration. So this slide is whole grains, beans, and legumes. So what is a whole grain? A whole grain is where the grain is left intact and all three pieces, the endosperm, the germ, and the bran, are left intact. And the whole grain includes all of the phytonutrients that exist, especially the vitamins, the minerals, especially the B vitamins. So trying to make sure you're choosing whole grains when you are choosing grains. Just looking at the time. This is one of our nutritionists. Her name's Sam Bateman. She also works with the Lifestyle Medicine Clinic. And this is actually a box that I also get delivered once a week. It's called a Misfits box. It's an easy way to get more fruits and vegetables delivered to your home this time of year. And you can, on their website, very easily pick what you want. It's an awesome way to get more in. And then adding more plant-based meals to try to have more of a plant-forward day. So these are just some simple tips like avoiding meat until dinner, picking one dinner a week to make meatless, using hummus and veggies as a sandwich filling instead of maybe meat, increasing your nuts and seeds by adding them to this time of year hot cereal, adding your nuts and seeds to grains and salads, and then maybe even making a crock pot or instant pot meal once a week that's mostly vegetables that you can portion out for the week that make great lunch leftovers. And then really perking up your taste buds by making sure that you are adding things to your vegetables, like adding a squeeze of lime, adding some zest, using some rice wine vinegar, and then really exploring spices. Spices can pack so much nutrition. Turmeric is a really popular one right now. If you're using turmeric in your cooking, make sure you add black pepper to really up the ante on how well the turmeric is absorbed. But turmeric can easily be added to plain hummus or eggs or bean dishes. And this is a favorite book. If you're not used to cooking with spices, Anna Sorden has a fantastic book that can kind of act as your Sherpa to help you figure out how to add spices to your cooking. And then I'm just gonna jump ahead to talk about meal timing and how that might affect your health, because this actually plays into a question that we got ahead of time about intermittent fasting and time restricted eating. So we know that eating early is more beneficial, definitely, and And actually, there has been a study of a shorter overnight fast of 13 or 14 hours, possibly protecting women from breast cancer recurrence. And this is actually a feasibility study that Dr. O'Donnell is working on right now in the Lifestyle Medicine Clinic. And the way that this works is really you just, if you wanted to fast for 14 hours, you stop eating at, let's say, 8 p.m. and your first meal might not be until 10 a.m. And this is a little bit shorter than maybe some of the 16-hour or 18-hour fasts that are being recommended that I'm not sure are feasible for the long term for most people. But I think a 13-hour, 14-hour overnight fast can pretty easily be implemented into your life. And it really just helps to eliminate some of the nighttime snacking that I think has really ramped up, especially during COVID. So the other thing that I wanted to hit on quickly is mindful eating. And this can go along also with some of the mindless snacking that I think is happening a lot right now during COVID, still with people being at home more. So taking a moment, if you can, to give gratitude for your food, thinking about where it came from, trying to eat without distraction, trying to really engage your senses and notice the colors and the smells and the texture and the flavor of the food. And then after you eat, really thinking about how it makes you feel are just some basic tips for mindful eating. It's a cute cartoon about if you're actually eating because you're hungry. And then I do want to hit on body weight quickly and still have time for a couple of questions. So body weight related to underweight, which as I mentioned before, can be really distressing for patients and caregivers. So if you've lost significant weight or muscle mass that's noticeable, really trying to pack your day with high calorie, high protein foods, avoiding things that are low fat, and trying to eat every couple of hours. Frequency is really important to kind of stop your body from using itself and its own energy stores for fuel, and always having a fuel source coming in. Fortifying all of your food with extra calories, getting into the mindset of like, what else can I add to this dish so that I'm adding calories, so that by the end of the day, you might end up adding 100, 200 calories extra just with adding some extra oil or nut butters. Drinking your nutrition can be really helpful. There's a million different smoothie recipes out there that can be customized to your own tastes. And then if you've had any GI surgeries, it's possible that you might be experiencing some malabsorption of nutrients, and we can help you out with that. If you've been on tube feeds, then we can also help maximize your tube feeds to help gain weight in a healthful way. And then also, I think it can be helpful to parse out if you've had significant weight loss, if it's weight loss or if it's cachexia, and that can be helpful in just managing expectations. So lastly, what about dietary supplements? Dietary supplements really include products like vitamins and minerals, amino acids, herbs, botanicals, plants that are marketed and put into capsules. And these are not regulated. So that's probably the number one issue. They could contain substances that aren't on the labels that could be harmful to health. And food really is the best source of vitamins, minerals, and other bioactive food components. And supplements shouldn't be used to prevent cancer. And that's really the bottom line. And these are some additional resources that I think are going to be put into our chat box, including our own website from the MGH Cancer Center. And that is it from me. And I think Jeff might have some questions.
Wow. Thank you so much. Those are both fantastic talks. I'm seriously going to recommend essentially that all of my patients who weren't able to join us today go watch these once they're up on video, and I'm going to do the same for basically all of my family members. I think much of what you said is relevant to people with cancer, but there's a lot of tips in there for prevention and people with a family history of cancer as well. Also, I'd like to say there were some great questions that came. We had a long list of questions that came to us even before, not to mention all the good ones in the chat. So I will quit yakking so we can get to some of them. But I do think we will be discussing how we can make this wealth of information available to people, beyond the videos more often, because there's so many good questions. So first, Dr. O'Donnell, You mentioned the guidelines of up to 150 minutes or more than 150 minutes a week of exercise, but there was a question about whether this applies to patients or for people going through chemotherapy or going through radiation therapy when they just may not be themselves. Is it the same recommendation, or how do you modify it?
So there are no specific modifications to those recommendations, but I think that all programs have to be tailored to a person's unique needs. So what are some specific situations where you absolutely would want to change what you're doing? If you're on a particular chemotherapy that drops your blood counts very low, including your platelets, you don't want to do weight-bearing activities that might result in bleeding into your joints. If you're anemic from your treatment, you may feel more short of breath when you try to do vigorous exercise. You may want to focus on low and moderate intensity, particularly at different phases of your chemotherapy. Something like my cancer, multiple myeloma, which is a marathon pace cancer, we tend to have we have different limitations in terms of people's bone lesions or bone tumors that we have to be mindful of when we choose exercises, but we're not limited during our treatment at all to doing activities. So that's a conversation, if you are in the middle of your treatment, that you could certainly have with your oncologist, but we're also here as a resource to help guide that if additional assistance is needed.
All right, I was muted. Let me emphasize that again. We put information through the chat that for those of you whose questions are not addressed, or if you've got very specific questions to your circumstances, that's exactly why this lifestyle medicine consultation was set up. So just, I think the way to get it is still talk to your care team, who can then put in the referral that'll get you into the queue for one of these consultations. So for Carol, there's a lot of questions about nutrition. One of them, ones that comes up a lot, both came up a couple times in the chat and comes up in my practice all the time. Are there foods in general, and you touched on this for sure, that a patient with cancer should try to reduce or eliminate? I know you killed me with the bacon only a few times a year, but I get it. But particularly, should we eliminate sugar and or dairy? You know, people were saying, what's the deal with dairy? So can you comment specifically on sugar and dairy? Yeah.
Dairy, mentioning calcium, how important calcium is in the chat, which I agree. And there's still ways to get calcium if you limited your dairy intake to maybe 2 servings of dairy a day and you included some dark leafy greens, then you'll meet your calcium recommendations for the day. And there is some discussion on whether the calcium recommendations in the United States are set actually too high when we compare fracture risk and fractures in the United States compared to other countries that have set their calcium recommendations lower than us. So I think that limiting dairy to 1 or 2 servings a day and getting calcium from plant sources is a good option. So dairy gets a bad reputation because there is a lot of information on the internet saying that dairy causes inflammation, which isn't necessarily true. And then there's also some information out there saying that dairy might raise IGF-1, which is insulin-like growth factor, and that could be harmful when it comes to cancer, which that isn't, we don't have enough information about that yet either. So I usually say leave dairy to maybe 2 servings a day. And then when it comes to sugar, it won't come as any surprise that sugar doesn't have any nutrition in it, right? So white table sugar, the problem is how sugar is usually packaged in our food to make food so delicious. There isn't a problem of people overeating sugar cubes. It's a problem when sugar is added to foods to make them much more delicious, and sugar sneaks into a lot of even health halo foods, like, for example, yogurt might have up to 20 grams of sugar, which is 4 teaspoons. So that's really the issue when it comes to sugar, is making sure that you're not having too much added sugar that could contribute to too many calories that could then lead to weight gain, which might not be good for cancer. But sugar itself, there's also some information on the internet stating that sugar feeds cancer. And while sugar does feed cancer cells, sugar feeds all of our cells. Sugar feeds us when it comes down to it. And we can't really control that. Even if you're on a ketogenic diet and you're following it really strictly, your blood sugar will never be 0. So that's probably a long answer to the sugar question, and I'm happy to answer that in more detail if anybody wants to have an appointment with us.
That's great. No, thank you so much. Listen, we're at the end of the hour. Thank you so much for those presentations and all the work you do beyond this talk today, helping our patients, and will continue to do to help our patients. And thanks for everyone who joined us today. Really appreciate that. On behalf of the Cancer Center. Bye.